Pain during sex, it's something that affects millions of women, but so many feel like they have to just put up with it in silence. Well, in this explainer, we're going to pull back the curtain on one of the most common medical reasons for this pain. And, maybe most importantly, we're going to talk about the very real ways to find relief. All right, so here's our game plan for today. We're going to kick things off with a really common but often unspoken question. Then we'll get into the science of what's happening, look at how it affects more than just the physical, bust some major myths, and wrap up with real, practical solutions. So let's just get right to it. The question that so many women are asking themselves, maybe even silently, is this: can something that sounds as simple as vaginal dryness really be causing this much pain? The answer is a huge, resounding yes. And just getting that confirmation is honestly the first massive step. It's about realizing that what you might be going through isn't some kind of personal feeling. Nope. It's a physical, biological reality. Okay, so let's jump into our first section. We're going to see how this pain is tied to a super common, and I mean really treatable medical condition. Okay, so this experience actually has a name. It's called Genitourinary Syndrome of Menopause, or GSM for short. And just giving it a name is so powerful. It shifts the whole conversation, right? We're not just talking about dryness anymore. We're talking about a real medical condition caused by a drop in estrogen. And once you can name it, you can start to treat it. So just how common are we talking here? Get this, between 50 and 70% of postmenopausal women are affected. That is a huge number. It means if this is something you're dealing with, you are absolutely not alone. The real issue is that nobody talks about it. It's so underreported, usually because of embarrassment or this myth that you just have to live with it. And here's something really important to understand. Even though menopause is in the name, GSM isn't just about menopause. Basically, any situation that causes your estrogen levels to drop can trigger these exact same symptoms. We're talking about things like certain cancer treatments, having your ovaries removed, or even breastfeeding. Okay, so what is actually going on inside the body that's causing all this discomfort? I mean, how can one little hormone dropping have such a big impact? Let's dive into the science of it. So think of it like this. Estrogen is basically the superhero that keeps this tissue healthy and resilient. When it leaves the scene, a few things happen. First, the tissue itself gets thinner, more delicate. Then, the stuff that makes it stretchy, collagen and elastin, that starts to break down. And on top of that, the little glands that make natural moisture start to shrink. So you put all that together, and it means that any friction can cause these tiny, really painful tears and inflammation. It's a whole cascade of events. And when women describe this pain, it's not vague, it's super specific. They talk about a burning or a stinging, or even a sensation of tearing or just rawness. For some, it's this deep ache that can hang around for hours or even days after. And you can imagine, right? Over time, your body starts to anticipate that pain. Your muscles automatically clench up to protect you, which unfortunately just creates this vicious cycle that makes everything worse. This obviously goes way beyond just the physical feeling. So now let's talk about the emotional side of things and the impact this can have on our relationships. This quote really, really nails it. It talks about how so many women feel this guilt or shame, like they're failing their partner, or like their own body has just betrayed them. That internal struggle, that emotional weight, is such a huge and often invisible part of this whole thing. I mean, it just makes sense, right? When something that used to be about pleasure and connection turns into something you dread, it's gonna put a strain on your relationship. Maybe you stop talking about it, you start avoiding intimacy, and all of that can really do a number on your self-esteem. Okay, this next part is a big one. Let's bust some of the biggest myths out there, the ones that keep so many women suffering in silence when they absolutely don't have to. All right, myth number 1. This one might be the most damaging of all. I'm just not aroused enough. It makes you turn the problem inward, like it's a personal failing. But the reality? This has nothing to do with your level of arousal. GSM is a structural, tissue-level problem. You could be totally into it, completely aroused, but if the underlying plumbing isn't getting that estrogen signal, the physical lubrication just isn't going to happen. Okay, next myth. Just use some over-the-counter lubricant and it'll be fine. And look, lubricants are great. They definitely help with friction at the moment. But here's the reality. A lubricant is like putting a wet bandage on a sunburn. It gives you temporary relief, but it does absolutely zero to heal the underlying issue, which is the tissue itself. And the final, and maybe most important myth to bust, this is just part of getting older. I have to accept it. The reality? Absolutely
Not. No way. This is not a life sentence. GSM is a treatable medical condition. Suffering in silence is a choice, not a requirement.
All right, so we've talked about the problem. Now for the best part, the solutions. Let's get into the actionable steps you can take, the real pathways to getting back to comfort and feeling good. So there are things you can start doing right away. First up, vaginal moisturizers. Now these are different from lubricants. You use them a few times a week, and their job is to actually hydrate the tissue. Then you have lubricants, which you use during sex to help with friction. And believe it or not, regular sexual activity with a partner or solo is actually good for the tissue. It helps keep the blood flowing and things more elastic. Now, when it comes to medical options, the gold standard, the top-tier treatment, is topical vaginal estrogen. It works right where you need it to restore tissue health, and very little of it gets absorbed into the rest of your body. If you're having other menopause symptoms, like hot flashes, then systemic or full-body HRT might be a good fit. And there are other cool options too, like laser therapies and, this one is so important, pelvic floor physiotherapy to help retrain all those muscles that have gotten used to tensing up. And here is why it is so important to actually do something about this. You know how hot flashes can sometimes just go away on their own? Well, GSM doesn't work like that. It's chronic and progressive. That means without treatment, it actually gets worse over time, not better. But the flip side of that is that getting help early can make a world of difference. So let's just end with this thought. What could change? What would it look like if suffering in silence was no longer the norm for this? Imagine the difference it would make in women's lives, in their relationships, and how they feel about themselves if this super common, super treatable condition was something we just talked about. The first step really is just starting a conversation, and a great place for that is with your doctor. Thanks so much for joining me for this.